A cardiologist is a medical specialty, and a vascular surgeon is a surgical specialty. That means a cardiologist goes through an internal medicine pathway, and then after that they do 1, 2, or 3 more years in cardiology, depending on what they want to specialize in, to become a cardiologist. And their specialty is of the diseases of the heart. Okay. And then a vascular surgeon is a surgeon, so he'll go through 5 years of general surgery and then 1 or 2 more years of specialization in vascular surgery.
This is the Healthy Lifestyle Solutions podcast, and I'm your host, Maya Acosta. If you're willing to go with me, together we can discover how simple lifestyle choices can help improve our quality of life. Let's get started. So welcome, Dr. Riz.
Thank you. It's good to be back.
In our previous episode, we learned a little bit about you and who you are as a vascular surgeon. You're here in the Dallas, Texas area, and your practice is North Texas Vascular Center.
Mm-hmm.
And by now, some of my listeners have probably already checked you out on social media, but your website goes in detail about some of those conditions that you treat. So in today's segment, I was hoping that you can clarify what is the difference between a cardiologist and a vascular surgeon.
Mm-hmm.
I was hoping that you can explain to my listeners what is the difference, and then how do you work together at times?
Well, that's a very good question. They are 2 different specialties. A cardiologist is a medical specialty, and a vascular surgeon is a surgical specialty. That means a cardiologist goes through an internal medicine pathway, and then after that they do 1, 2, or 3 more years in cardiology, depending on what they want to specialize in, to become a cardiologist. And their specialty is of the diseases of the heart. Okay. And then a vascular surgeon is a surgeon, so he'll go through 5 years of general surgery and then 1 or 2 more years of specialization in vascular surgery. And I'm actually utilizing my previous experience. Those pathways have changed now, and and they're different from what I trained 25 years ago. I think the pathways for vascular surgery are now 5 or 6 years, depending on what you want to do. And so what you've got is we are actually 2 very different specialties. One is a surgeon, one's a medical specialist. And the cardiologist specifically treats diseases of the heart. And those diseases might be heart failure issues, rhythm management issues, and or atherosclerotic issues. Atherosclerosis meaning the buildup of plaque or blockages of the arteries that supply the heart.
Mm-hmm.
Okay. And then a vascular surgeon treats the disorders of the blood vessels of the body outside of the heart and outside of the brain. The neurosurgeon does it inside the brain. The cardiologist does it in the heart. And then I, as a vascular surgeon, treat all of the blood vessel disorders everywhere else. And that might mean that I treat the blood vessels of the neck, the blood vessels in the chest or in the arms, or in the abdomen or in the legs. And blood vessel disorders come of varying types, just like heart disorders. Blood vessel disorders can include aneurysms, which is areas where the blood vessels dilate and get bigger, much like a bleb on a tire where they can rupture. Other disorders include inflammatory disorders like vasculitis. And then there can be disorders of the lymphatic system and disorders of the vein systems. We can treat blood clots in the veins. And then, one of the primary main areas of vascular surgery is treating the buildup of plaque or atherosclerosis inside the arteries. Okay. And plaque can build up inside the arteries in the neck, in the arms, in the arteries supplying the intestines, and in the legs. And that's where there's overlap in the specialties of cardiology and vascular surgery. The cardiologist treats the atherosclerosis or plaque of the coronary arteries or the arteries of the heart. I treat atherosclerosis of all of the other arteries in the body. So we both have a common area where we treat a common disease, but the cardiologist treats that disease in the heart, and I treat that disease everywhere else.
Interesting. Is a cardiologist not necessarily a surgeon? That would be a heart surgeon?
Yeah, so a cardiologist is not a surgeon.
So they don't go in and do open heart surgery?
No. So there's 2 specialists in the heart that treat the heart. There's the cardiologist, and there's a varying degree of what those cardiologists might do. And then there's the cardiac surgeon.
Wow.
The cardiac surgeon does the operative or surgical interventions of the heart.
Mhm.
Okay. The cardiologist will do the medical therapy and the minimally invasive things, treatments of the heart. And when I say minimally invasive, that means when you go through a puncture in the arm or the groin and you go up and you do an angioplasty with a balloon or a stent or something like that in the heart. And so on the vascular surgery side, there's not a medical therapist and a surgical therapist. The vascular surgeon does do all of that.
Wow.
Okay. So uh, as a practitioner, I diagnose, I manage, and I treat. And my treatment might be the minimally invasive route, or it might be the surgical route.
Okay. Wow. The more you come on the show, the more that we'll be able to talk about chronic diseases that you treat. How do patients end up seeing you? Is it a referral system?
Yeah, most patients come to me from other specialists.
So
Um,
they just can't walk in the office and say, "Hey, Dr. Riz, can you treat me?"
Well, I mean, you can make an appointment to see me, but it's a very advanced specialty where it's not a simple diagnosis, and most people don't know how to diagnose their own problems.
Sure.
I do believe that diabetics and people with foot wounds all deserve a vascular evaluation. And if you have those kind of problems, you're obviously more than welcome to contact me, and we'll do everything we can to help assess you and help you get better. But oftentimes, these patients already have doctors, primary
Mhm.
care doctors, cardiologists, family practice physicians, podiatrists, who are already seeing them for those issues. And then
Okay.
that's where I typically get my patients from. But if you're a patient without a primary care doctor and you got a foot wound, I encourage you to seek care somewhere, and hopefully you'll eventually get where you need to be. And one of those places is with me for an evaluation of your circulation.
That's right. Wonderful. Thank you, Dr. Riz. And stay tuned for the next segment. The next time you come on, we're going to talk about heart disease.
All right.
All right. Thank you, Dr. Riz.
Thank you.
You've been listening to the Healthy Lifestyle Solutions podcast with your host, Maya Acosta. If you've enjoyed this podcast, do us a favor and share with one friend who can benefit from this episode. Feel free to leave an honest review as well at ratethispodcast.com/HLS. This helps us to spread our message. And as always, thank you for being a listener.